The purpose of this video is to explain how you can use the literature matrix to help you to organise your work and look at the evidence to seek answers to your clinical questions. My name is Judy Monday and I am the Unit Coordinator for NSB203 Inquiry in Clinical Practice. A literature matrix is a useful tool designed as a table which can assist you in organising your findings when reading and reviewing literature. A literature matrix helps you to get organised, to synthesise the literature, to find answers to your clinical questions. Once you have completed your literature searching and have some articles to review, the literature matrix can be used to summarise the key points of each article. Use the template matrix that we have provided to get you started. You can find this on Blackboard. The first thing to do is to write down your evidence-based practice question. This will assist you in staying focused on the question and help avoid getting sidetracked. In the example provided, I am assessing whether for adult patients undergoing surgery, if passive warming is more effective than active warming in preventing perioperative hypothermia. It is important to clearly identify each journal article or paper that you include in your matrix. The first column asks for the author and the date of each paper. This is the first paper that I am going to insert into my literature matrix. This paper answers my question, or at least it appears to. I can see that the author is Alderson et al. And I can also see that the date is 2014. I will write this in my table. Now I have clearly identified the first article to be included in my matrix, I will look at the second column. The second column asks me to consider the research question or aim for each paper or article. At this point, it is helpful to consider if the aim or question of the article is similar to your evidence-based practice question and therefore should be included. Next, write down the population, sample and setting from the journal article you are interested in. Again, as you complete it, think critically about whether the population, that is, the set of people that the study was focused on or the participants, is similar to the population that you are interested in, i.e. your patients. Also write down the setting. For example, was this a community or a hospital setting, and again, is this relevant to your question? Next, we think about the study design. You might find this in the title or abstract. However, you should also read the methods of the paper to determine what study design was used. This will assist you in deciding whether you will use the paper to answer your clinical question. Next, we consider the study design. You might find this in the title of the article, in the abstract, or you might need to look at the methods of the paper. This will assist you in deciding whether you will use this paper to answer your question. It will also help you work out the level of evidence later on. In the findings column, write down what the study found, i.e. what the results were. It is helpful to look for and note down the findings that help to answer your EBP question, remembering that the article might contain other findings that do not answer your question, as research papers might have several different questions they seek to answer. In this instance, you are only concerned with the findings that answer your question. In the next column, we want to write down a summary of what the article concludes about the topic. In addition, we think practically about what this means. This will help to determine the implications for clinical practice, and these are often detailed at the end of the article. In the level of evidence column, we need to indicate what level of evidence this paper represents. Here we ask you to think back to the NH and MRC levels of evidence, remembering this is appropriate for quantitative evidence only. You can also look at the 6S pyramid. Remember that we aim to seek the highest level of evidence. Completing this column can help you to assess overall the level of evidence that exists to answer your question. Finally, it is always important to understand the limitations of the research. Remember, there is no such thing as a perfect study. Well-written articles should always include a limitations section, so this would be a good place to start. However, you may also have noticed deficits or limitations in the paper that they have not acknowledged. And now, repeat this process for the other studies that you have found. You can add as many rows as you like. This will be a useful tool for NSB203 Assessment 1, but you are also required to complete a literature matrix for Assessment 2.